Hello guys, welcome back to my channel Ages Kingdom. In this class, I am continuing the topic from the nursing research only, visual analog scales. So you can see visual analog scales when you are speaking. This is also one method of data collection, and you can see the definition. Visual analog scales is a psychometric, because already since long time I am using the word. All attitude scales mostly used for psychosocial analysis. So psychometric response, the scale that is used to measure the intensity of certain sensations and feelings such as pain, discomfort, anxiety, quality of sleep, severity of clinical symptoms, functional ability and attitude towards the environmental conditions. This has 10 centimeters lines and ends marks semantic opposite, alert or drowsy. So in this visual analog scale, best expression I can tell you, being a nurse is mostly we will see the pain scale based on the expressions. This scale also is having a top level of expression and low level of expression. And when you see feelings, especially it is speaking about sensation, because it is not a measurable externally, it is completely qualitative assessment, not a quantitative. So based on these qualitative sensations or assessment, like feelings such as pain, discomfort, anxiety or quality of sleep, or severity of clinical symptoms, functional ability and attitude towards environmental condition. And when you see visual analog scales, VAS is a tool that is used to assist a person in rating the intensity of certain feelings and sensations, especially in cancer wards and all. If they are suffering with a chronic pain, then they will use this type of scales only. So the VAS is a bipolar scale used to determine the degree of stimuli a patient experiences. So one side of the scale expresses the absence of stimuli, while other expresses the presence of stimuli. So best examples you can see, suppose stress or pain or discomfort. When you want to see, suppose scale will be 0 to 10. So unbearable distress, so we give as a 10. And color coding also you can understand. Green means the symptoms or the feelings are less, and none are annoying or uncomfortable. Then in between, if it is not completely none, it is not severe, then they mixed with the yellow color, and the red color indicates a unbearable or severe pain. That's an example of visual analog scale. And numerical rating scales or visual analog scales or differential scales, all these scales will be having this one only. So no pain 0, and worst pain imaginable, that is none, mild, moderate or severe. Like this they will keep a rating scale. And when we see comparative pain scale chart, I think this everybody knows. That's So everybody knows this is a comparative pain scale, pain free, no pain, and mild pain, moderate pain and severe pain, based on the expressions. And they made a pain scale. So that is about visual analog scale. And this is all different kinds of scales they are using. This is Lego pain assessment tool. Here also they are giving a 10 category from 0 to 10, and based on that only we are going to evaluate. So that is about visual analog scales. Then we will see other scales, and this is visual analog scale. Also they may ask for 5 mark score. Mostly it is also psychosocial analysis, mostly psychological feelings like sensations they are going to use, and it is having a good valid expression, so that we can able to evaluate the patient feelings or the person's feelings very easily. And that is the advantages of visual analog scale. So thank you for watching. If you really like my class, please do subscribe. Thank you.